So if someone promises you 100 brand new RPM patients next month, ask one question. Is that growth? Or is that compliance debt that I'll have to pay for later? So look, 2026 is changing the map. United Healthcare's commercial and individual exchange policy, effective January 1st of 2026, draws a hard line on what's medical necessity for RPM and labels many common indications as not medically necessary. Meanwhile, CMS is expanding options in advanced primary care management, including new add-ons in 2026 for codes centered around behavioral health. So here's the part that people are missing. The OIG this year published a Medicare RPM data snapshot, and they flagged sudden spikes in new enrollees as a marker for additional scrutiny. They actually found 32 practices where new RPM enrollees jumped at least 150% in a single month, meaning at least 100 new patients in only 1 month. And one practice billed RPM for nearly 3,400 brand new patients in a single month. So the OIG says spikes can be legitimate, but these spikes have been fraud markers in other Medicare services in the past, and it signals to them that an investigation needs to happen. So if you run your own program, you'll be tempted this coming year to make it up on volume when coverage tightens. If you use a third-party RPM company, they probably feel the same pressure as well, especially if a payer change like United Healthcare hits their bottom line. Either way, that enrollment spike can create a compliance debt really fast, like patients onboarded faster than eligibility can keep up, medical necessity issues, and documentation gaps. So before you green light a big enrollment push, I would demand 3 things. 1, a month-over-month enrollee report. 2, proof of the required visit and the ordering relationship exists for each patient. And 3, evidence that your clinical management and documentation will keep up at scale. Now, if you have a third-party company and you're worried about their revenue leakage affecting your compliance and fraud risk, we've got additional resources at fairpath.ai to help you.